Glucagon-like peptide-1 receptor agonists, or GLP-1 RAs, have become increasingly popular for managing type 2 diabetes, especially in older adults. These medications are well known for their metabolic and cardiovascular benefits, making them a go-to choice for many physicians. However, there's still uncertainty about how GLP-1 RAs affect bone health, particularly the risk of fragility fractures in this high-risk population. As the number of older adults living with type 2 diabetes continues to rise, understanding the broader impacts of these therapies is more important than ever. This video explores new research that sheds light on the relationship between GLP-1 RA use and fracture risk in older adults. Investigate the potential link between GLP-1 RA therapy and fragility fractures. Researchers conducted a large population-based retrospective cohort study. They used data from the nationwide Cloud Health Services database, focusing on people aged 65 and older with type 2 diabetes who started GLP-1 RA therapy or comparator drugs between 2018 and 2022. The primary outcome was the first occurrence of a fragility fracture. Participants were followed until they experienced a fracture, died, or reached the study's end date in March 2024. The study used advanced statistical methods, including inverse probability of treatment weighting and multivariate survival analysis, to ensure the results were robust and accounted for differences in baseline characteristics and the competing risk of death. The study included over 46,000 participants, with more than 11,000 using GLP-1 RAs and nearly 35,000 using comparator drugs. During a median follow-up of almost 3 years, about 9% of participants experienced a fragility fracture, and 10% died. After adjusting for baseline differences and the risk of death, the results showed that new users of GLP-1 RAs had an 11% higher risk of experiencing a fragility fracture compared to those on other diabetes medications. These findings highlight the importance of considering bone health when prescribing GLP-1 RAs to older adults with type 2 diabetes. Clinicians should weigh the benefits of GLP-1 RAs against potential risks, especially for patients already at higher risk for fractures.